Well, thanks for joining us, everybody, today. We have a special guest, as I'm sure many of you know, Cynthia Bailey from Real Housewives of Atlanta. So she's going to be patching in really soon, and we're so honored to have her and blessed to have the opportunity to talk with her about her experience with AirSculpt. Another thing we're going to do today is show the before and after, the 1 week before and after from Jess, our arms patient from last week that Dr. Perkins treated. So that's super exciting. We're going to show you her 1 week, which isn't her full result, but a little bit of before and after action there. And I want to also announce that we're going to be opening our Scottsdale, Arizona location in the month of July. So we're going to speak with Cynthia about her experience. We're then going to go into a question and answers with her. And then we're going to talk about the area that she had done in general and go over some questions and answers on that. So again, we're just so honored to have an opportunity to speak with Cynthia about her AirSculpt experience, and we're looking forward to it. So she should be on any minute now. In the meantime, what we can do is answer some questions about back bra roll. That's the area we're going to talk about today, and that's Cynthia's before and after picture behind us. So let's talk about, let's go over a few before and after some back bra roll questions that we had over the last few days. Please go ahead.
All right, so someone is asking where the actual entry points are for the back bra roll.
Great question. So back bra roll is a great area because you can really, really hide the entryways. So first of all, just like I say every week, the entryway is only this big, which is 2 millimeters, or the size of your average freckle, not mole, freckle. And what's great is the back bra roll incision points are all covered in natural folds of skin. There's only two. One is right in here, and the other one is right in here. So it's in a skin fold, and one is right where your arm meets your back, and the other one is your waist. So that's very important, and it's never been a major problem in terms of scars at all, even with people that tend to not scar well. Let's keep going.
Someone actually has some back pain from the excess fat that she's had. Will this removing the back bra roll, will this help her have less back pain?
That's a great question. We've had a lot of people with various kinds of musculoskeletal pain say that AirSculpt has removed their pain. Most common is having your tummy done, and that helps with hip and knee pain. But I have had patients who have a lot of back bra roll fat say that their back pain has been relieved by having their back bra roll done with AirSculpt. So it's possible. It's not something that we promote, but if you do have a lot of fat in any area and it's removed, it should relieve pressure and weight, which tends to cause pain. What's another question?
Oh, Cynthia's
here.
Awesome. Let's see.
Let's make sure that before and after is easy to see.
You got it. Cynthia Bailey. One moment.
Hi, Cynthia.
Hi.
Thank you so much for joining us today. We really appreciate it. It's such an honor. We're a big show.
Please, anytime. I'm the one that's honored. Thank you so much, Dr. Rollins.
Oh, thank you. So we'll go right into it and ask you some questions, and then we'll go over some of your fans and elite patients that have questions for you.
Okay.
So first question is, what made you choose AirSculpt?
I chose AirSculpt because I'm a woman of a certain age, number one. So although I, work out and I try to eat healthy, there's like certain areas on my body, like my back, like my waist area, that no matter what I really did, I just wasn't really seeing any results. So I felt like AirSculpting was a great option to just kind of help me be able to target those areas that I wasn't really seeing any results from exercising and eating right.
Diet and exercise resistant fat is the best that's what we're here to do. That's all we do. So thank you for choosing AirSculpt. I'm very honored.
You're welcome.
Thanks. So what were your goals, and how do you feel about your results?
My goals were basically to just have more confidence in the areas that I couldn't really lose the body fat from. You know, as a celebrity, someone in the public eye, we get criticized a lot. And, you know, my whole background is kind of fashion. So I want to wear like the low cut dresses. You know, I'm getting married this year. So I definitely am looking at a wedding dress that's backless. And I know it just sounds small, but again, being in the public eye, like we get a lot of criticism. So I just wanted to look as well as I felt inside. I just wanted to look good and feel good. So those were my body goals, to just target those areas so that I can just be comfortable, you know, just in my own skin and just having less fat in certain areas, basically. And you know, the results were, how am I loving feeling about my new body? I love it. I'm really glad that I did it. You know, it's something that it's one of those things, you know, again, as you get older, I don't mind getting older. I, you know, talk about my age a lot, but I still want to look as good as I can look inside and outside.
Of course, yeah, and that's what all of our patients want. Absolutely. What areas did you target?
My back, I definitely, over the last couple of years, I just got like back fat, like out of nowhere. I know I've gained a little bit of weight, but for some reason, it just was kind of really residing more in my back, which was not a good look for me. So.
No one likes back bra roll, and I'm telling you,
ain't nobody got time for back fat.
No,
so.
they don't. They don't. We call it BBR, back bra roll, and it's really, once you have back bra roll, I don't know anyone who's gotten it and lost it on their own. It's the most tried and exercise resistant stuff.
Like honestly, like my fiance would tease me because it was like a little Sharpay on my back. I was like, I like Sharpays, I just don't want to look like one. So there you go.
And a
but
lot
also
get it done before they get married, actually.
Exactly. And also my stomach, you know, my stomach definitely, I wanted to get a little bit out of there. I feel like, you know, my stomach is hard, but it's just, you know, it just still had some fat there. So I was like, okay, let's get that together a little bit, because that's another area where I struggle. And also my waist. I was like, you know what, it seems like it's, you know, I could have a little help there, but it was all like minimal stuff. Like I didn't want like some super snatched waist or some, you know, I didn't want the extremes. I just wanted to kind of keep what I had, but just tighten everything up just a little bit.
That's very, very common. Not everyone that we do has like, I always hold this up. They don't have a gallon of fat to be removed. A lot of people, it's just little pockets of diet and exercise resistant fat, people that are in great health and great shape. And no matter what they do, they can't get rid of them. And that's one of the things we're here to do.
Right.
And tell me, you know, I really like the way, so we have your before and after behind us. I love how doing the back bra roll on the waist gives you more of an hourglass shape. Can you show more? So you can see her after pictures right here, and you can see that.
Oh yeah.
See like more of this shape, and I think that's really, really nice.
Yes, absolutely. I love it. I'm really happy with it, because again, it wasn't about like, you know, changing my outside appearance, of not being happy with what I look like already. It was just fine tuning what I was already working with.
Yeah, exactly. I'm so glad you did it. And would you tell us about your AirSculpt experience?
Sure. You know what? One of the things that I was concerned about was having to go under like anesthesia and all that stuff. So I was really happy that I could be awake for the whole procedure. That's number one. That was a really big concern for me. And I didn't want anything too invasive. Like I didn't want like to be, you know, poked and prodded with like big instruments and all that stuff. I really wanted something invasive. And what I love about air sculpting, it's like tiny needle. Like I really didn't feel any pain. It was like only when the fat was being sucked out, it was like a little, I could feel like a vibration. And it was fun. I mean, I was like checking emails the whole procedure, to be honest, and FaceTiming with Mike. So I really loved that when I had the consultation with you guys told me that it wasn't going to hurt, and it actually didn't hurt. So that was good, because sometimes, you know, that's not always the case. Sometimes you're like,
I
well, it
know.
actually does hurt. So,
Yeah, I know. Yeah.
but that wasn't the case with air sculpting. And that was definitely great, because, you know, it was a speedy recovery, and all for all of those reasons, because it wasn't so invasive.
I'm so happy to hear that. And so a lot of people are asking, was it painful? And a lot of people think it will be, and they're nervous before. And you know what?
It's not. I mean, I don't know what everyone's level of pain is, but I mean, if something hurts, for me, it hurts. I don't have like such a huge high threshold of pain tolerance where I know pain when I feel it.
Yeah.
And for me personally, it didn't hurt. Like, you know, for anyone that's a mom, you know, if you've had a child, okay, you're gonna be fine with air sculpting. Like, I'm just really exaggerating, but I really pointed out moms, because I know sometimes, even like after I had Noelle, there was like certain areas of my body that just kind of changed. And it was difficult to kind of get everything back. But no, I would say it was painless. Obviously, you could, again, feel the vibration, but I did not walk away from the procedure like feeling like I was like a gutted pig and it hurt. Like, I was fine. As a matter of fact, you know, my recovery time was like really quick, to be honest. I was fine.
I'm so happy to hear that. Okay, let's go over some questions from your fans and AirSculpt patients. They want to know what your consultation was like.
My consultation was like simple. It was pretty quick and easy. I basically came in, talked to the doctor. She kind of walked me through what was going to happen, what the procedure was going to be like. I checked out the office. The staff was friendly. Everything was nice and clean. And I made an appointment. It was just as simple as that.
Cool. Okay. You know what a lot of people ask is, what was it like to see AirSculpt remove the fat before your very eyes?
I think that was the best part. I think that was my favorite part, because it's like, you know, it's in there. You've been looking at it on your body, and to see it being sucked out and in this like little container, a clear container, and it's like, you know, you wonder what it's gonna look like. I mean, it's just like, it almost looked like a smoothie, like a strawberry smoothie kind of.
Yeah.
Like, I know that sounds gross, but it did, and I just was like, more. Like, once I saw it like rising up, but it wasn't even, you guys didn't even take out that much, to be honest. But you know, it was exciting to just see, like, you see this cup and you think, oh my God, it's gonna be like full of fat, and it actually, for the areas that were targeted and areas that came out great, like, I was like, wow, I feel like it probably would be more fat than what was actually taken out. But that was my favorite part. I
love that too.
There's nothing like seeing fat leave your body.
No, there's nothing like it. I totally agree. And the next question was, what was your level of energy like after your procedure?
You know what? I was fine. I kind of felt like, you know, when you work out and you haven't worked out in a while and you're like a little bit sore, but it feels good because you know you've done something that's going to help you be great. It was kind of like that. Like, I was a little sore, but not like anything where I had to take, I don't even think I had to take any like prescription pain medicine. I think you guys may have prescribed some, but I really think I was able to honestly get away with just Tylenol for the most part. I was fine.
Most people Tylenol or ibuprofen 800. I don't really like to give people prescription pain medicine because it's not good for you.
Right.
Yeah.
Right.
So,
and I don't really like to take it unless I'm really, really in pain. And I was fine with Tylenol.
I'm really happy to hear that. And then when were you able to get back into your daily routine?
I'm a pretty busy woman. So honestly, I pretty much, I just took the day off the first day because I just wanted to, you know, properly recuperate. And probably the next day, honestly, I was able to do some stuff. I mean, I was just trying to be a little mindful, but I pretty much went back to work like in the, you know, next 48 hours. I was fine, but I did just give myself some time. Just because I wanted to give myself some time, but I was fine.
Did you have a cheat meal before your procedure? A lot of people do.
Oh, of course, absolutely.
What did you eat?
Absolutely.
My
What did
question.
I have? You know what? I think I had a chicken salad from Chick-fil-A or something and some lemonade.
Okay.
And I think I did get the waffle fries too. Don't hold me to surprise, but I enjoyed. I definitely didn't go into the procedure hungry. I'll say that.
Good, good. I don't want people going to procedure hungry. Okay, I have a really important question for you. When did you start seeing results?
Honestly, I had like the waist compression thing on.
Mm-hmm.
So I felt like, honestly, pretty much, I don't want to say almost right away, but like the first week, like when I would take it off and clean everything, I could definitely tell in my waist and in my lower back that it was definitely different. And by that second week, for sure, I started seeing like definite results. And I was like, pleased, so pleased, because, like we were talking about before, it's frustrating when you just can't get rid of certain areas no matter what you do. And to be able to have air sculpting, and it kind of, at least give you a little kickstart on trying to like eliminate that issue, because it's like depressing to work out and you don't see anything happening in that area. So it was like very motivating as soon as I started seeing those results to actually work out more and be even more conscious of what I was eating, because I was actually more inspired. I was like, oh, okay. Like as soon as you start seeing like, wait a minute, okay, little waist is coming back. It was good.
I hear that all the time, that the more of a result you get, the more you want to keep it and get even a better result. Yeah.
Absolutely. Now I have a confession though. I do have a confession. During the quarantine lockdown, like I was doing good until I got locked down for 4 months with my family in Los Angeles. So I actually gained a little weight back during the quarantine because I was like basically in prison and I couldn't go anywhere. So I was doing a lot of cooking and eating. So I did gain a little weight during the quarantine, but honestly, the areas where I had air sculpting are still good. But if you get bigger, your body just gets bigger. It just is what it is. But now I'm back on my plan, and already just for me, not eating like a pig and being able to go out into the world a little bit more, I'm snapping right on back. And again, the least of my issues were the areas where I had the air sculpting.
Oh, that's wonderful news. I'm so happy to hear that. And if you need any help before your wedding, you know where we are, right?
Don't say it unless you mean it. I mean it. Come back.
We got you. I mean it. Yeah.
Well, thank you. I appreciate that. I appreciate that.
Let's see if we have any other questions. How do your entry points / scarring look as of today?
You know what? They look fine. They're almost like the size of little less than, if you have like an old school pencil, like a number 2 pencil, or the number 2 pencil, like the eraser part, like they're about that size, but a little smaller. But I have to say they're like fading out, really well. So it's nothing that, I look at and it doesn't bother me at all. It's almost like, you can barely see it. I know it's there, I think, because I know that it was done there. Mm-hmm. But, when I'm, with my man, he's like, what's that? What's all this stuff? It's not like anything like that, because it's really like not really noticeable. But I would say maybe just a little less smaller than the size of like the end of like a number 2 pencil. And no stitching required. They healed like really well. Like they healed up probably, they like scabbed over like a week and a half, peeled off, and then they like heal fine. But I'm kind of like, as a Black woman, anytime I have any kind of cut or incision, I always have the chance to maybe leave a dark spot anyway. That's kind of individual. So for me, I do always tend to have a little bit of, what is it, hyperpigmentation, with areas.
Yeah.
But it's fading like really well, and I will put on a swimsuit, a 2-piece, and be very happy. It's fine.
I'm so happy to hear that. That's great. And those little number 2 pencil marks should actually go away completely. So
yeah. Oh, they're fading out like less and less and less. So
wonderful. Yeah. And last question: would you recommend this procedure to your fans?
Absolutely, like 100%. I am so happy that I had it done, because it was just easy. I got the results that I wanted, and it's like painless. It's like if you have like those little stubborn areas, especially like, again, I'm speaking to, I'm talking to the young folks too, but women of a certain age, our metabolism slows down. Like it's just a little harder to kind of keep achieving the body goals that we want. the body goals that we want. So anybody that's had a baby, you know, I'm a mom, I'm older, I fit like all the criteria for something like this. I would absolutely, highly, 100% recommend this. It's easy, it's painless, and you know, you'll see those results. And it, you know, it's just gonna motivate you to continue to, you know, live a healthy lifestyle and to like try to stay in shape, you know, whatever your individual body goals are. You, again, for me, someone that's on television, you know, I'm in the look good business. So I want to try to look as good as I can look. And there's only so much I can do, especially with my schedule on my own. So this was an amazing option for me. And I highly recommend it.
Thank you so much. I just want to thank you again for coming on and sharing your experience with everybody. It's a real honor that you've been willing to do this, and I can't thank you enough.
Oh, no, you're so very welcome. And again, thank you guys. Again, I'm getting married 10-10-20. I got a dress that I got to fit in. And again, regardless of what my weight is right now, the low back area, that's a hard place to lose weight. And
Sure.
This is an amazing option to have to just get rid of that low part, because I want my back to be great as well as everything on my body.
Okay.
So thank you to your whole team. Everyone was super nice, super sweet, super professional, and I was very comfortable there. And I didn't, you know, feel like, you know, I didn't, you know, I don't know. It just, as again, someone in the public eye, I felt very much like you guys really catered to me, and it was very private, and you guys were very helpful, and just made me feel, you know, good and welcome. So I appreciate that.
Thank you so much, Cynthia. It's been an honor.
All right. Well, thank you so much. And I might see you soon. I don't know.
Hey,
I'm going to see.
I mean what I say. So I got you, especially before your wedding.
Okay. All right. Well, thank you guys. And if you guys haven't tried it, if it's something that you guys are thinking about, don't be on the fence. It really is worth it.
Thank you so much. Okay.
All right. Take care. Bye, you guys. Bye, everyone.
So there you have it. That was our interview with Cynthia Bailey. That was just a delight. Thanks again, Cynthia. It was wonderful and such a great experience to get a chance to talk to you about AirSculpt. Now we're going to show you our Jess's arms, our patient from last week. We want to show you her 1 week before and after. A lot of people watched last week having her arms done, and here we go. Let's take a look. So this is the front view. So this is the front view, and this is her before picture. You can see kind of this whole thing going on, and in 1 week it's already straight. I mean, take a good look there. But what's great about this result here is she's going to look immensely better in 3 weeks. So to look like this in 1 week, I'd like you to show me any modality, any body contouring technology that can do that in 1 week. You guys watched it with your very eyes on video, and to see that a level of change in 1 week is tremendous. And her arms weren't even that big. The fact that we can even see a noticeable change in 1 week is really splendid. It doesn't get better. So I'm so happy with Dr. Perkins, and Jess is elated. This is much better than her expectations. And again, 1 week is not her result. Her result is going to take up to 3 months for her arms. So they're only going to get skinnier and skinnier. So they will never be a problem area again. I can assure you of that. So, and we'll continue to show you people's results that we show on our video every Thursday at 4 o'clock. Anything else, Lauren?
We do have some back bra roll questions.
Okay.
Some are actually worried about the excess fat. They want to know how much fat can actually be removed.
Great question. As I show every week, exactly 5 liters. So this is about 1 gallon, and we have taken that out of people's back bra roll before. Another thing I want to mention about back bra roll that's really important is a lot of times when we do someone's back, your back fat is connected to your armpit fat. Armpit fat, or what we call front bra roll, is an incredibly important area to do. We haven't done it on this program yet, but a lot of women, especially after having kids and breastfeeding, they get excess armpit fat, and it's very diet and exercise resistant, just like back fat. And we tend to do the back bra roll or the back fat together with the armpit fat so that we get a smooth clean out. And then suddenly blouses fit better, jackets, etc., dresses, of course. And they have almost the same incisions. It's just one more little mark with this little tool here to do the front bra roll. And this whole area right here is extremely important to do. It's actually one of my favorite areas where people say that made the biggest difference of everything they did. So, but we have taken and can take up to 5 liters of fat out of that area. Typically, I'd say our average patient gets a liter out of each side, but we can go up to 5 liters. So, what are the questions here?
How do I determine what the difference is between a back lift and a back bra roll with AirSculpt?
Well, if you have lost a ton of weight and you have just loose skin with no fat, you would need a back lift. And that's a very intense surgical procedure where they remove a whole bunch of skin from your back and you have a big scar across your back. With AirSculpt, we all know there's no needle, no scalpel, no stitches. And we're here to remove the fat and then make your skin tighter than it was before. But if you don't have fat, then we're not for you. AirSculpt is just to remove fat and then tighten the skin in the area we removed it.
Awesome. Someone's asking if the back bra roll will affect the size of the breasts.
Great question. So if you do your back bra roll, it makes your torso look more slender, which actually makes the breasts look bigger. You see this even more when you do the front bra roll with the back bra roll, because if you remove this, it defines the breast. So I highly recommend that. And many times when we do fat transfer to breast, we also do either the back bra roll or the back and front bra roll to complete the look. It gives definition to the breast.
And then one last one. Someone's asking if the compression garments will interfere with the fat transfer.
No, our compression garments were designed by me at Elite Body Sculpture exactly for this procedure. So we give you the compression garment, it's engineered by us, it's as comfortable as we could possibly make it, and it does not interfere with anything. Thank you all for watching. It's been a real pleasure to be back here and chat with you about AirSculpt. And if you have any questions, please DM us. If you are interested in a consultation, there's many ways of doing it. We can do it in person. We're open in all locations. You can do it virtually. We have everyone standing by right now. So if you're interested in learning about how much it costs, if you're a candidate, or when and where to schedule, please DM us, email us, give us a call. In fact, we'll put a phone number you can call on after this, after we sign off here. Thank you so much, and I'll see you next week.